أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين سيدنا ونبينا ومولانا محمد صلى الله عليه وسلم وأصحاب أجمعين السلام عليكم ورحمة الله تعالى وبركاته. We thank Allah once again for granting us the opportunity to engage with Tibba Nabawi, the prophetic sunnah relation to healthcare. And tonight's topic, continuing from the topic of elimination, we are speaking about cupping therapy. Just to mention that due to the fact that Maghrib is earlier nowadays, we are having the class next week after Isha, after Maghrib. After Isha next week. Bismillah ar-Rahman ar-Rahim. So what is cupping therapy? We find that throughout history, in ancient Egyptian times, long before Hippocrates, for tracing back hundreds of years, that cupping has been an important component in many societies. Evidence of cupping therapy can be found in the times of the pharaohs. We find in the tombs of the pharaohs that pictures of cupping sets were inscribed into the tombs, and cupping was considered to be the medicine of the elite. So the elite of the society used to have access to cupping. And we find that this tradition carried on through the years until it reached Arabia. And during the Prophet ﷺ's life, we find that of all the medicinal systems that reached Arabia, he chose a few therapies. And cupping is one of those well-celebrated therapies within Islamic medicine. So there's about 28 ahadith speaking about the importance of cupping. I'm just quoting a few of it. The one hadith that's found in Ibn Majah, the Prophet ﷺ said that on the night of the Isra, when the Prophet ﷺ went to the different heavens, he said that he did not pass any group, meaning any group of angels, on the night of Al-Isra unless they advised him, "O Muhammad ﷺ, tell your ummah to do cupping." Another famous narration found in both the compilations of Bukhari and Muslim, the Prophet ﷺ said that cupping is the most helpful procedure for humans to cure themselves. In other words, cupping is your best medicine. Another hadith found in Bukhari, the Prophet ﷺ said that healing can be found in three things: drinking honey, the blade of the cupper, and cauterization. Cauterization refers to the cessation of blood by burning certain wounds closed, but this form of therapy was later abolished. The Prophet ﷺ spoke against cauterization later on. However, cupping remained to be the advised therapy. The best medicine with which you treat yourself is cupping. This hadith is also found in Bukhari and Muslim. So what is cupping? The Arabic word that relates to cupping is hijama, which refers to a sucking motion. So cupping, the technique, involves the use of a cup or a bell-shaped vessel placed onto the skin, and a vacuum suction is created. In other words, air is sucked out of the cup in order to raise the skin inside the cup. And the purpose of this is to increase blood flow to the area. So once cups are placed on the skin, the action of sucking up the skin changes the blood supply. It affects the veins, the arteries, the capillaries, the muscles. It changes the way blood flows through the body. And in that we find healing. So there's a saying in natural medicine, wherever blood flows, healing goes, because blood is seen as the life force in the body. So the blood circulation delivers oxygen and nutrients to every part of the body, but it also gets rid of waste products. So whenever blood flows well, circulates well, we find there's good health. Whenever blood remains stagnant or the circulation is stopped, we find there's a start or the beginning of disease. Cupping is also very effective when it comes to pain management. For those healthcare professionals that wish to gain a deeper understanding to the science in cupping, the mechanisms of action, at the end of this month I'll be delivering a paper at the Islamic Medical Association's conference. I'll be presenting a paper on evidence-based cupping. So at that conference I'll discuss randomized controlled trials and I'll talk about the mechanism of action. For this gathering we'll keep it very simple. So what's the point of placing cups on different parts of the skin? So we said once the cup is placed on the skin is sucked up through a vacuum. There's two methods of doing that. There's a vacuum gun which is attached to the cup, which sucks the air out of the cup. Another method is called the fire method, whereby you place a flame inside the cup. This absorbs the oxygen in the cup, and the cup creates a suction within the cup. So the cupping practitioner chooses specific points on the body to place the cup. So to understand the benefits of different cupping points, we have to take a look at the skin. The skin is recognized as the largest organ of elimination in the body, because via the skin pores, the body releases sweat, different toxins, salts, and when cups are placed on the skin, it increases the elimination of waste. So when cups are placed over a healthy area, the effects of cupping can barely be seen. You'll see a slight circular ring which can be light pink, showing good circulation. When the area beneath the cup has a lot of toxins that wasn't eliminated properly, the skin will be more dark in color. So a dark red to a purple color would indicate stagnation in the skin. So bear in mind that the body has mechanisms in place to get rid of waste, like the blood circulation, the lymphatics, parts of the body inside muscles constantly gets rid of waste on a day-to-day basis. But due to our lifestyles and the diets that we have that has a lot of fats in it and sugar and byproducts, we find that the body cannot eliminate waste products efficiently. So therefore, cupping is a very good detoxification therapy. So you get basically two types of cupping. Dry cupping refers to the application of cups on the skin, whereby the skin is drawn into the cup and the cup is left on for anything between 5 to 15 minutes. Before the cups are placed on the skin, there's a certain oil that's rubbed on the skin depending on the condition. So for instance, for arthritis, we'll rub on black seed oil, because black seed oil increases heat in the body. It's analgesic, so it helps with pain. And then we'll place cups on the certain joints wherever the pain is. Wet cupping refers to the extraction of blood from the cupped area. So in Arabic, this cupping is known as hijama. This is the sunnah that the Prophet ﷺ practiced. He didn't practice dry cupping, he practiced wet cupping. So wet cupping refers to the application of the cups as in dry cupping. However, depending on the practitioner's discretion, once the cup is removed, a surgical blade is used and fine scratches would be made on the skin. So like little paper cuts. And the skin will eliminate droplets of blood through the pores or through the paper cuts. And we find that the blood that's eliminated through there is highly concentrated in uric acid, metabolic waste, basically waste products that the body is trying to eliminate. So the body releases the amount of blood that it has to release. But it's important that it's done via a cupping professional, a practitioner in cupping, because cupping is a science. So that brings me to the next point, that it's very important to realize that cupping within the Sunnah is seen as a medical occupation on its own. The Prophet ﷺ went to a cupper, a person that was designated as a cupper. And the hadith mentions that once he had the cupping done, the Prophet ﷺ paid the cupper. And this indicates that it was a profession, as opposed to something that's done on the side of the streets. So within the Sunnah, medical ethics is very important. The aspect about looking after the patient, ensuring that there's good hygienic practices. So we find worldwide, because cupping is so popular amongst Muslim societies, that it's done in a very haphazard fashion. It's done with little consideration for the medical ethics involved. So because blood is involved, it requires training, medical training. It requires that the blood be disposed of in proper medical waste dirt bins or waste disposal methods. The cupping professional should wear gloves. There should be surgical blades being used. It should be done in a protected private environment. So there's many criteria to follow. So within South Africa, we have TIB practitioners that are registered and have a license to practice cupping. So it's very important that if you wish to seek out this therapy, that seek it through the registered authorities. We are not saying that people that don't have any registration papers are not trained in cupping. The problem is, firstly, it's possible that someone could spend years under a sheikh and learn how to do cupping and gain the medical advice, but not have the papers to prove it. However, how do we know who's who? But if you go to a cupping practitioner that's registered and connected to an institution, for instance, at our institution, I train cupping. And in order for students to qualify, they have to study 5 years full-time. So the first 3 years, from 8 to 5 o'clock, they're studying the human body, full-time. So they have to first obtain a degree in science. They have to obtain a Bachelor of Science degree in complementary medicine, where they learn about the entire human body, physiology, anatomy, the bone structure, diseases. They have to learn about diseases under the microscope. They have to do practical work. And once they gain that qualification, they enter the clinical environment. And within the clinical environment, they have to give hundreds of hours of observation first. So for hundreds of hours, they're first watching, they're observing cupping therapy. Then they write a cupping theory exam, which they have to pass. Once they pass that, they're allowed to perform cupping under supervision. So a patient would come and they would go through the patient's history. And it's very important to note that cupping is a sunnah treatment, but it's not recommended for everyone. Because cupping takes away excess from the body. When someone is depleted, they don't have that excess to give. So it's possible that cupping practiced incorrectly can be harmful. So some people incorrectly say that because it's a sunnah treatment, everybody can get cupped. That's not true. It's a sunnah treatment connected to a sunnah way of practicing medicine. So very important, seek registered trained practitioners. So when you obtain or you seek out a practitioner that's trained through an institution, they have the practice number, your rights are protected also. In the event that something goes wrong, you have a body to approach, a regulatory body that ensures that these practitioners practice correctly. So within the sunnah, there's many benefits to cupping. Cupping on the back and the neck area is said to treat 72 illnesses. We must also remember when it comes to the sunnah, when numbers are given, often numbers are given to indicate many. So when the Prophet ﷺ, when he says that he makes istighfar 100 times a day, it doesn't necessarily mean 100 on the dot. It's telling us that he performed abundance of istighfar. So number within Arabic language, within a hadith, is there to show numerous. The Prophet ﷺ mentioned in the hadith, the best treatment is cupping because it removes blood, which lightens the back and sharpens the eyesight. So we find that cupping points is very beneficial for migraines, for joint pain, for backaches, for muscle pain. There's various illnesses cupping can benefit. For overall general health promotion, it can reduce stress and anxiety because when we are stressed, we find that tension accumulates in the neck and the shoulder region. It can promote blood purification because once that blood is extracted, the healing mechanisms of the body aims to replace that blood. And when that blood is replaced, that fresh blood is free of the waste products that was in the original blood. So when blood tests are done on people that undergoes cupping, when you look at the cupping blood, it's highly concentrated. You'll find lots of waste products in there. Cupping can improve digestive complaints as well. So you must remember both dry and wet cupping is beneficial. However, wet cupping is the sunnah treatment. But for some individuals, dry cupping would be better. It can improve and benefit respiratory conditions. like asthma, sinusitis. Cupping is very effective in pain, for pain-related conditions, so migraines, arthritis, joint pain, muscle tension, sport injuries. And the reason for this is that cupping blocks pain receptors. So within the body, when you pinch yourself or burn yourself or prick yourself, there's certain receptors, nerve endings that picks up that message, takes the message to the spinal cord, right up to the brain. The brain sees it as a pain feeling of heat or sharpness. It sends the message back to the area and you feel that sensation of pain. When cupping is administered on the skin, it can affect 4 inches into muscle. So it reaches a different type of receptor known as mechanothermal receptors. And those receptors meet at the same junction where the pain receptors meet. And at that junction, it blocks the pain. So because cupping is deep penetrating, it causes the tissue to rise, it changes blood supply. In that physiological mechanism, the changing of the blood supply, we find it abolish the pain messages. So cupping is very effective when it comes to injuries, when it comes to past injuries. For instance, an injury that seemingly healed, but however, now and then you'll find when you're sitting too long on the injury, there's pins and needles, for instance. So in conditions like sciatica, backache, arthritis. And today we find these ongoing studies, evidence-based studies. So in medicine, the highest level of testing is called RCTs, randomized controlled trials. And a few years ago, it would be difficult to find these studies on cupping, but today cupping is so widespread that daily you find new studies on cupping and very high-level studies. So we find another hadith where the Prophet ﷺ said that whosoever performs cupping on the 17th, the 19th, and the 21st day, they will find a cure to every disease. So the 19th and the 17th, 19th and 21st of every lunar month. And when I came across the hadith a few years ago, I done some research to find out what's the significance of these days. And if we look, we find that our lunar calendar, as the name says, would be determined by the cycle or the phases of the moon. And during the middle of the month, we find that after the spring tides, after the moon is full, the ocean levels are at its highest. And all the rivers, all the water-filled places in nature, the oceans, the rivers, the water level will be highest around about this time. And if you look at our physiology, we are made of 3/4 water. We are more than 70% water. So around about this time, our blood, the levels in our blood, there's different levels of waste products. And we find that the heaviest waste products will be higher up in the blood. The more harmful waste products will be closer to the surface of the skin around about this time. So when you perform cupping on these nights or these days, the 17th, 19th, and 21st, the toxin elimination is improved. If you couple this hadith with the Prophet ﷺ's practice of fasting on the 13th, the 14th, or the 15th, it means that the fasting on those 3 days further detoxifies the body. So if you live the sunnah as far as you can, your detoxification process will be heightened. And I'll end off with this hadith where the Prophet also mentioned and reminded us that the best medicine with which to treat yourself is cupping therapy. So I'll welcome some questions on the topic. For those that's wanting to find a place whereby cupping is practiced, the Sama Center is one place that offers registered cupping practitioners. I remember about 2 weeks ago there was a question relating to cupping, Someone asked the question, can wet cupping be administered to a female during menstruation? Within Islamic medicine, menstruation is also seen as a process of elimination. So we wouldn't advise wet cupping and menstruation at the same time because it will be too harsh in terms of the body's elimination process. It will be too draining on the patient. Carl, welcome. The questions relating to the topic. Okay, one question that was asked relates to the Banting diet. Is the Banting diet in line with Tibb Nabawi, or is it contrary to it? Is it recommended or not? So the Banting diet, which talks about no carbs, high fats, can benefit some people, but it's not beneficial for everyone. So within Tibb Nabawi, we don't advocate generalizing a diet without a consultation. So a patient has to be consulted, a thorough history check, look at what conditions they're predisposed to, and then the recommended diet is given. So we don't promote an extreme in any type of food. So we wouldn't say have this food and abstain from that one in totality unless it's a condition. So for diabetics, low carbs would be beneficial because we know that carbs does increase blood supply. So Banting can be beneficial, but not a generalized statement. How often should you be cupped? Once again, cupping is also a type of therapy that's given or prescribed according to the patient's needs. For general health promotion, so there's no illness condition, but you want to have hijama regularly, once a season would be beneficial. Because we find that red blood cells are made every 2 to 3 months. So to have cupping once a season would be good. And remember, when it comes to cupping, the practitioner diagnosed a patient. So they look at the patient's features, they look at the lifestyle, they look at the diets. People that donate blood, they would deal quite well with cupping. If you're able to donate blood and you feel fine after donating blood, you can most likely go for wet cupping. People with low blood pressure, caution will be administered. People with low iron levels, there's blood conditions. If you have coagulation conditions, that's why it's important to note that you have to be trained. There's a checklist that practitioners are trained to rule out cupping. So before we administer cupping, we go through a checklist to see why we shouldn't do cupping in this patient. In other words, does the patient pass all of these checks? If you have a blood condition, if you're on blood thinners, if you have a coagulation problem and cupping is done, it will cause excessive bleeding. So in cupping therapy, when blood is eliminated, it's seen as an elimination process. But if a person practices cupping without knowing what they're doing, they can incorrectly recognize or see excessive blood as elimination when in actual fact it's causing harm. So we find that for hundreds of years, cupping therapy was practiced almost all over the world. In actual fact, for 500 years, it was the main form of medicine in Europe. To such a degree that cupping became so common, it was practiced in the barber shops. So I'm sure we all know the classical sign of the barber shop, that white pole with the red and blue line going up. That is actually an indication that there's a cupping practitioner at the shop, because they used to do cupping with bloodletting. So the white pole represented holding a staff or a pole in the hand in order to cause the veins and arteries to protrude, and then they would administer what they call bloodletting. And the red and the blue lines are indicative of arteries and veins. So cupping became such a popular practice that it moved out of the medical fraternity into the streets. So we find that people used to go for a haircut and for cupping. And what used to happen, that the profession spilled over into into the layman's hands, where people practice cupping without knowing what they're doing. And because of the malpractice, this is one of the reasons why cupping was abolished in Europe. And it also coincided with the time when microbiology was basically founded, when doctors linked all illness conditions to microorganisms. So when they could see a bacteria, they came to the conclusion that every illness is due to a presence of a bacteria. So all this traditional medicine was basically sidelined. But today, we find there's a re-emergence, there's a revival of cupping therapy due to the scientific evidence and the need for cupping. So right around the world, especially in the Muslim countries, cupping therapy is practiced at a high level. It's practiced in medical institutions. We find that universities are training cupping practitioners, and there's large research projects run by medical schools. So for some people that require cupping for joint pain, cupping can be done weekly for 2 months, but that would be dry cupping. We wouldn't do wet cupping continuously because the body has to replenish. Are there any other questions? Okay, I'm going to go on to my next topic, which talks about illnesses. And we said in Tibba Nabwi that Tibba Nabwi teaches us the principles of medicine. It teaches us on how to look at health and disease. And there's certain principles that coincide with the modern view of medicine and health, but there are certain recommendations that we cannot find in modern medicine. And when it comes to illnesses and sickness, we find that the Prophet ﷺ was the most perfect in character, most perfect within his body. He had the highest level of hygiene. Every cell of his body would be pure. The Sahaba would mention that even the Prophet ﷺ's sweat smelled like musk. However, he suffered many illness conditions. And the illness that he suffered was on a higher level to that of ours. Because he said that because he has this heavy weight of being a prophet, Allah tests him heavier than any other type of human being. And it was Ibn Mas'ud that came to visit the Prophet once, and the Prophet had a fever, severe fever. And the Prophet informed him that my fever is double the intensity of yours. But at the same time, the Prophet also informed him that fever to the body is like fire burning the waste products of metal. In other words, he was saying that illnesses is a purification for the body. And the Prophet also taught us that we should view illness as an opportunity for cleansing. And if you look at illnesses, for instance, the flu, when you inhale a virus, it causes influenza, the nose becomes stuffy, you spike a fever, the body goes through processes to get rid of this virus. So it's a cleansing process. When you have a fever, the body is trying to heat up to create an environment that's not easily livable for the bacteria. So in Islamic medicine, illnesses is viewed as a healing, as a cleansing process. And therefore we find that the Prophet also mentioned that if you have patience during the healing process, it is an expiation for sins as well. Imam Ghazali said that sicknesses are Allah's servants attached to his chosen slaves. So there's various ahadith that the Prophet ﷺ encourages us to be strong and to have a firm yaqeen and sabr during illness. He said that no calamity befalls a Muslim except that Allah expiates his sin because of it, even if it be a prick from a thorn. So whatever pain a Muslim feels, when he accepts that pain in the correct manner, it becomes a form of purification for him. If Allah wants to do good to somebody, He afflicts him with trials. Aisha radiallahu ta'ala said that she never saw anybody suffering from so many illnesses like the Prophet. Why is it that the most beloved of Allah's creation would be afflicted with illness? وَمَا أَرْسَلْنَاكَ إِلَّا رَحْمَةً لِلْعَالَمِينَ. It is as a mercy and a form of consolement for us. That when we go through our trials and tribulations that can never be on the level of the Prophet ﷺ, we can draw from that example. That if Allah chose His most beloved to go through these trials, who are we to complain about our illness condition? So it's no problem to complain to Allah about the condition. but to complain about the condition and see it and why me and go into a severe state of grief. So the natural reaction is to feel sad, to feel disheartened. Therefore, we are encouraged to encourage people that are ill to lift up their spirits. The Prophet ﷺ also mentioned for those people that are struck by blindness or some diabetic patients, when it's very severe, they lose their eyesight. Allah says that if I deprive my slave of two of his two beloved things, meaning his eyesight, and he remains patient, I will let him enter paradise in compensation for them. So we find that throughout the Sunnah, if you look at the lives of the awliya, you would see that some of them found peace in illness, because during the illness condition, they are reminded about death. They're reminded about the weakness of the body. In fact, Umar radiallahu anh was struck by illness condition, and he was seen to, he showed a bit of weakness. And the Sahaba questioned him and said that, Umar, you are the mighty Umar, the strong one. Why are you succumbing to this condition? So Umar said, why should I display my bravery and strength when Allah has chosen me to be weak right now? So understand that illnesses has a place in our life, and lessons can be learned from it. It can improve our emotional, our spiritual, and our physical state if we accept it like that. So definitely scientific studies have shown that if you compare two patients struck by any illness condition, both patients are struck by cancer, which is a terminal illness, very common today. People view it as something, they view it as a death sentence, but it isn't so. If you look at two patients and the one has very strong connection to the deen and the one forsakes himself, you will see that the one is connected to deen has a better quality of life because of the positive connection that they have to Allah. It improves the quality of life. So they might go through similar stages, but the one who gives up, who does not connect to Allah during the time of adversity, they suffer more. And it can be measured in their body, in the immune system, the white blood cells. So those people that are very positive, they have a stronger fighting spirit. We find when it comes to illness conditions, we are encouraged to visit the ill. We are encouraged to visit them because we recognize that they have a close connection to Allah at that time. Their du'as are very high in the sight of Allah. The Prophet ﷺ reminded us that out of the good deeds that we do, we should ensure that we feed the hungry, visit the sick. The du'a of the sick person is never rejected until he recovers from his illness. Very important to also note that when we visit the ill, the Sunnah also teaches us adab and courtesy. We said that Tibba Nabawi is about courtesy. The medicine is in the Prophet ﷺ's adab. So when you visit the ill, be considerate. So in other words, ensure that you don't just randomly visit the people, because we don't know what the condition is. Especially people that have terminal conditions. Today could be an easy day, tomorrow could be more difficult. So phone the family, ask permission to visit. Keep your visitations very short. Go with positive messages. Speak good, give hope. Keep the visit very short and sweet. Make dua for the person and remind them that they have a close connection to Allah. So when you leave, they should be in a better state than they were before you came. And most importantly, respect the caregivers. If you're visiting people in hospital, when visiting hours are over, leave, or leave 10 minutes before visiting hours. Make the job easy for the nurses, for the doctors, because we don't know what they go through. And you might think that if I hang around longer, I'm showing the patient I care for them more, but you're making the job of the healthcare practitioner more difficult. And it could be your stubbornness in leaving that provides less or inferior healthcare to the patient because they're unable to fulfill their job properly. So definitely know that within sickness, the Prophet ﷺ reminded us that there is a cure. There's a cure for spiritual illnesses. Some illnesses can cure the body because it takes us to a better state of health. But if you approach illnesses emotionally from Tibba Nabawi by looking at it in a positive light, by recognizing that we are not afflicted by anything except that it will benefit us in some way. We will overcome our illnesses in the best of ways. وآخر دعوانا أن الحمد لله رب العالمين.